Now let us see the topic of drug interaction. So what is drug interaction? So drug interaction is nothing but it is a effect, or else it is a biological effect or modification of the efficacy of one drug. So we are administering a drug. Before the drug showing its efficacy or before the administration of another drug, whatever the side effects which are shown by the drug apart from its normal effect. So if a drug, apart from its biological effect, what are the effects that are showing in the body? So that is called as drug interaction. So if I see the types of drug interactions, there are various types like drug-drug interaction, drug-food interaction, drug-disease interaction, physiological interactions and pharmaceutical interactions. So what is the risk factor, or else what are the risk factors which are aiding in this drug interaction? So first thing is that polypharmacy. So if we are giving more than one drug, or if more than 2 or 3 drugs are administered at a time without any gap, then that leads to drug interaction. And the other one is multiple prescribers. So a person is going to a doctor and he is taking medication, and if that disease or he is not relieved from that pain or discomfort, he is going to another doctor and he is taking prescription. So because of the multiple prescribers, all the doctors or all the medical practitioners, they won't prescribe one drug for a disease. For example, if we take cold, so one doctor or one prescriber will give one drug and the other one will give the other drug. So the prescription is not the same. So because of the multiple prescribers or multiple prescriptions, that lead to drug interactions. The other one is multiple pharmacies. So if we are going to pharmacist, if we are taking one medication in a medical shop, so we have to take that drug itself. So if we go to other medical shop, that drug may not be available and he may give some other brand. So that there gives the changes. So multiple pharmacies can also lead to drug interactions. The other one is genetic makeup. Due to the genetic effects or due to the hereditary effects, that leads to drug interactions. And in if we take some specific population like old people or infants or elderly people, if we take that age groups, even the age groups also have the drug interactions. The other one is specific illness. So if a person is having some hepatic or liver related disorders or kidney related disorders, then if he is taking any drug which may lead to toxicity of renal or kidney, that may lead to drug interaction. And the other one is narrow therapeutic index drugs. So the drugs like digoxin, insulin, lithium, antidepressant drugs, warfarin. So these are the drugs we should give an accurate dose. If the dose exceeds its limit, then it will lead to side effects, and if the dose reduces then its limit, that may show no effect. So these narrow therapeutic index also, because of the overdosing, can lead to drug interactions. What happens or what are the consequences because of these drug interactions? One thing is that the drug will lose its efficacy. So whatever the drug we are giving, the main drug which has to show its biological effect, that may not show its effect, and there will be loss of therapeutic effect and there will be toxicity. So because of the interactions with the other drugs and with the food or related disorders, that may lead to the unconscious, or else that may lead to side effects, so or adverse effects, which is leading to the toxicity. The other one is unexpected increase in the pharmacological activity. So these drugs, if you are giving because of the inducers or because of the drugs which show synergistic action to this drug, the pharmacological activity of these drugs will be increased. So that also may lead to side effect. And sometimes it may have beneficial effects also because of this drug interactions. For example, if we take 2 drugs, these 2 drugs show the same action, and if we are combining these 2 drugs, that will show synergistic effect, that may show a better efficacy or better treatment. The other one is chemical or physical interactions. For example, we are giving a drug through IV route, and if we are giving through IV route, the same syringes or the same fluids should not be administered at the same site. So that may lead to the severe adverse effects of administration. If we see the mechanism of drug interactions, there are 2 mechanisms. One is pharmacokinetic and the other one is pharmacodynamic interactions. So if we saw the various types of drug interactions. Now let us see what are drug-drug interactions, how one drug is reacting with the other drug. So if we see in these drug-drug interactions, they are pharmacokinetic interactions and pharmacodynamic interactions. So what are pharmacokinetic interactions? In the sense, what is happening to the drug in the body? So if we see, it alters the GIT absorption. So the GIT absorption, because of the drug-drug interaction, if one drug is reacting with the other drug, what happens in the GIT, or what happens to the GIT absorption? So it may lead to the altered pH. So whatever the pH should be there in the GIT, that may be altered because of the drug interactions, and altered bacterial flora. So in our intestine, there is a bacterial flora which is very useful for the body. So these organisms may die, and thereby the absorption capacity or the protective capacity of the GIT may be reduced. Now the one is formation of drug chelates or complexes. So this, when one drug molecule is reacting with the another drug molecule, it may form newer compounds. It may form the chelating agents. So that leads to the toxic effect. Another one is drug induced mucosal damage. So few drugs have the capacity of stimulating the oversecretion of HCl. So if the drugs overstimulate the secretion of HCl or acids in the stomach or GIT, thereby that leads to the mucosal layer depletion. The mucosal layer may get degraded, and that may get damaged, and there will be altered GIT motility. So the movements in the GI smooth muscles may be altered. There may be higher contractions, or there may be a relaxing state for longer period of time. Altered pH. So if we see, the ionic molecules cannot cross the blood plasma membrane or whatever the membrane barrier it may be, but non-ionized molecules can cross easily. So non-ionized molecules are lipidic in nature, so they are more lipid soluble, and thereby they get more absorbed. Whereas ionic, they are water soluble, and thereby they get less absorbed. So thereby the pH can be altered in the body. If we see the examples, so here antacids. Antacids are the agents which reduce the or else which alter the pH on the stomach. So these antacids, they decrease the pH. So if we take the antacids and ketoconazole, so this ketoconazole, when it is given in the form of tablet, so they reduce the dissolution, or they reduce the distribution of the ketoconazole in the body. So when these are given with antacids, because of the reduced pH. And if we take the H2 antagonists, they also reduce the pH, and thereby the distribution or the dissolution of ketoconazole can be reduced. So if dissolution is not proper, dissolution should happen at particular pH and particular temperature. So if this pH and temperature are altered, the drug won't get dissolved in the body, and thereby the drug is not distributed. So these two drugs, they aid in the, or else they alter the dissolution capacity or the distribution capacity of the drug ketoconazole. So that is the reason this drug or antacids or H2 antagonists, they have to be given with ketoconazole. A gap of at least 2 hours should be given. So if we take altered intestinal bacterial flora, so intestine contains some bacteria which are very good for the body. They aid in the metabolic capacity, or they aid in the absorption of vitamin K. So here if we take the digoxin, so digoxin is such a drug, most of the people, 10% of the drug, or else if we say the 40% or more digoxin is metabolized by the bacterial flora. So here when we take digoxin, 40% is metabolized by the bacterial flora which is present in the intestine. So here if we take the antibiotics, so if we take the antibiotics with digoxin, these antibiotics, they kill the bacterial flora, and thereby the digoxin is not metabolized. So if it is not metabolized, it is remaining in the circulatory system for longer period of time. So that leads to the toxicity of digoxin, because digoxin is a therapeutic index, narrow therapeutic index drug. So if it exceeds its normal dose, then that leads to toxicity. The other one is complexation or chelation. So few drugs, when they combine together, they form chelates or they form complexes. So if we take the tetracyclines, so tetracyclines, it interacts with the iron preparations, or it interacts with the milk, calcium which is present in the food. So these tetracyclines, they should not be given with iron, or they should not be given with during while we take milk. So there should be some gap given. And if we take antacids, especially the aluminium or magnesium hydroxide preparations, this should not be given with tetracycline, because these drugs, they reduce the absorption of tetracycline. So that is the reason these should not be given with tetracyclines. The other one is drug induced mucosal damage. So here the drugs like anti-neoplastic agents like cyclophosphamide, vincristine and procarbazine, these are the drugs which inhibit the absorption of several drugs. So if they inhibit the absorption, so if the drugs are not getting absorbed, so they are remaining in the systemic circulation. They stimulate the excessive, or else what do? They become toxic in the body. So if they are toxic, that leads to the mucosal damage. For example, if we take drug like digoxin, so these digoxin should not be given with antineoplastic agents like vincristine, procarbazine, because they reduce the absorption of digoxin. So if it is not absorbed, it is remaining in the systemic circulation, and if it remains, it aids in the stimulation of HCl, and thereby the mucosa is getting damaged. Altered motility. If we take the example of drug like metoclopramide. So metoclopramide is an anti-emetic drug. So it prevents the emesis or vomiting. So here this metoclopramide, it increases the absorption of cyclosporin. So cyclosporin, because of the gastric emptying time. So here the metoclopramide, if we combine the metoclopramide with cyclophosphamide, the gastric emptying time, in the sense the time taken for the contents of the stomach to move out of the body, will be reduced. So because of that, the cyclosporin will get absorbed very easily, and if the absorption of this increases, and thereby it will lead to the toxicity of the cyclosporin, and thereby the GIT motility, because of the GIT decreased GI motility, this interaction is happening. The other one is displaced protein binding. So few drugs, they bind to the plasma proteins which are present. So here one drug will displace, or else it takes the place of that drug and it binds instead of the drug. If we take the example, phenytoin is such a drug which is having 99%, phenytoin is such a drug which is having 90% plasma binding capacity, and tolbutamide has 96% and warfarin has 99%. So here the drugs like aspirin, sulfonamides and phenylbutazone, so these are the drugs, they won't allow these phenytoin, tolbutamide and warfarin to bind to plasma proteins. So they will displace, they will move away these drugs, and they will get attached to the plasma proteins in place of these drugs. So this is one type of interaction, drug-drug interaction, which is going on in the body. So if they are not binding, this will affect the distribution capacity. The drugs won't be distributed properly in the body. The other one is altered metabolism. So one drug may affect the metabolism of the other drug. So if we take the examples like carbamazine, so this is an anti-epileptic drug. So here most of the metabolism, it occurs in the liver. So rarely it occurs in the skin, WBC cells also, but most of the part takes place in the liver. So the enzymes which are there in the liver, if the enzyme induction takes place or enzyme activation takes place, so this carbamazine, even because of its activity, it allows, or else it increases or stimulates the liver enzymes. Thereby its own metabolism is increased. So it is altering its own metabolism. And the drug like phenytoin, it increases the metabolism of theophylline. So if the metabolism is increased, then its efficacy will be decreased. And if we take the example of other drug like erythromycin, it will inhibit the metabolism of the drugs like astimazole and terfenadine. So if these drugs metabolism is reduced, they are available in the body more, and that leads to the toxic effects of this drug. For example, these two are the drugs which are very life threatening, and that may lead to cardiotoxicity because of their overdose. The other one is omeprazole. So omeprazole, it inhibits the oxidative metabolism of diazepam. So if it is not getting metabolized, that leads to the diazepam poisoning. The other one is renal excretion. So few drugs, they won't allow the other drugs to get out of the body. So they won't allow the excretion of other drugs. For example, the drug like probenecid, it won't allow the drug called methotrexate to excrete out of the body. So if it is not getting eliminated out of the body, then that remains in the body for longer period of time, leading to the toxicity of that drug. The other one is passive tubular reabsorption. So here, whatever the non-ionized drugs are there, they get reabsorbed, whereas ionized drugs, they won't get reabsorbed very easily. So when compared to ionized drug, non-ionized drugs or non-bound drugs which are not bound to the plasma proteins, they get reabsorbed very easily. So even the reabsorption capacity of the drugs can be altered. So the drugs like lithium, so here the sodium bicarbonate, so if the sodium bicarbonate, it won't allow the lithium, or else it increases the lithium to get out of the body very easily. So it won't allow the lithium to get reabsorbed into the body. So that leads to the decreased action of lithium. So it will eliminate the lithium out of the body, leading to its decreased action. The other one is antacids. So antacids, if we give it salicylates, so these antacids, they will eliminate the salicylates out of the body, and thereby the salicylate effect is reduced. Let us see the pharmacodynamic interaction. So what are the pharmacodynamic drug interactions which are taking place? So here if we see the drugs like propranolol and verapamil. So if we give propranolol along with verapamil, that will lead to synergistic effect, or else in the sense that will lead to potentiation effect. So this propranolol and verapamil, they are used in antihypertensive agent. They are used as antihypertensive agents. So if we combine these two drugs, that will show better antihypertensive effect. So if we see some of the few logical equations, synergism means additive, synergism means addition effect. So what is that? 1 plus 1 is equal to 3. So 1 plus 1 is equal to 3 means what is the net result? It is showing more potency than its net result. And if we see additive effect, 1 plus 1 is equal to 2. In the sense, it is showing the double effect. So it is showing the double effect, then it has to show. Whereas synergism, it is showing more than the double effect, then it has to show. Potentiation means 1 plus 0 is equal to 2. If we give one drug molecule, then it is showing the double effect when without combining with any other drug. The other one is antagonism. So 1 plus 1 is equal to 0 or 0.5. In the sense, if we combine two drugs also, this drug will antagonize, or else this drug will nullify the effect of other drug, thereby the net result is 0. If we see the types of these pharmacodynamic interactions, that is synergism, additive effect, potentiation and antagonism. And this antagonism is further classified as chemical antagonism, competitive antagonism, non-competitive antagonism, physical antagonism and pharmacological antagonism. So if we see, this is the example of an antagonism. So here the glutamate, it binds to the glutamate binding site of NMDA receptor, and thereby it shows various effects. So here if we see the other side, the glutamate place is replaced by an antagonist, and thereby it is not allowing the glutamate to show its action. So that is leading to the nullified effect or no effect. If we see the drug-food interactions, so the drug may react with the food or the dietary supplements which are given, or it may react with the alcohol also. So if we see the examples, so here the drugs like terfenadine, cyclosporin and felodipine, so these are the drugs which react with the grapefruit juice. So the grapefruit juice or the flavonoids which are present in the grapefruit juice, they interact with these drugs, and thereby there will be the reduced absorption. So the absorption and efficacy of these drugs will be reduced if they are given with grapefruit juice. And the anticoagulants should not be given with vitamin K supplements or foods which are rich in vitamin K, because this vitamin K, it is an anticoagulant, and if we give these anticoagulants with this vitamin K, that will lead to excessive bleeding or hemorrhage. And the drug should not be given, the drug like digoxin should not be given with oat. Why this should not be given with oats? Because these oats, they won't allow the absorption of digoxin. So these oats will interact with the digoxin, and thereby the absorption of digoxin will be reduced. And tetracycline should not be given with calcium containing foods, because this tetracycline will react with the calcium, and thereby the tetracycline absorption will be reduced. The other is drug disease interactions. So here in few of the diseases, the drug should not be, few drugs should be contraindicated. For example, here the drugs, for example, if we take one drug, if it is very useful in diabetes, the same drug may be harmful in another disease like renal failure. So here this is called drug interaction. So this drug disease interaction is seen in most of, we can say in any age group, this drug interaction is seen, but it is most commonly observed in the elderly patients. So for example, if we take the beta blockers, so if we give these beta blockers in heart related disorder, that may lead to increased blood pressure. So these beta blockers, they aid in the contraction of the blood vessel, and thereby the blood pressure can be increased, and thereby it may also worsen the condition of asthma because they cause constriction of the bronchi. And some drugs should not be given with cold. So few drugs should not be given with to treat cold because that may worsen the glaucoma condition. So if we are giving the treatment for cold, then few drugs have to be contraindicated, because if we give these drugs, then that may worsen the condition of glaucoma. The other one is physiological interactions. So physiological interactions are nothing but, if we take a receptor, it is having two different binding sites. So two drugs can bind to that, and two different drugs will bind to the same receptor, but they show the same effect, but they are binding to two different sites. For example, if we take aspirin is having anti-platelet action, in the sense it won't allow the platelets to form aggregates. If we take warfarin or coumarin, they are anticoagulants. They prevent the coagulation mechanism. The effect is same. It won't allow the platelet aggregation, thereby clot is not formed. It won't allow the coagulation mechanism, thereby the clot is not formed. But the binding sites of these two drugs are different. So two binding sites, but the effect is same. That is increased bleeding. Pharmaceutical interactions. So pharmaceutical interactions are nothing but during the preparation of any drug, we add various excipients. So this actual drug or main ingredient may react with the excipients or other flavoring agents or the other coating agents which we are given during preparations. So we have to take care regarding these interactions. So here it is occurred because of mixing two or more substances or compounds, and thereby because of these mixing, that may lead to an undesirable product, so which is not desirable for us, which is not needed for us. So such a compound is formed, and thereby it will affect the safety and efficacy of the drug. So the main ingredient which is there, it may lose its efficacy, and that may become toxic. These pharmaceutical interactions are of two types. One is physical interaction, the other one is chemical interactions. Physical interaction is nothing but the appearance is altered, in the sense the appearance of the drug, or else if we are preparing a solution. So solution should be a clear liquid. So because of this pharmaceutical interaction, that may form precipitation. So if the precipitation is formed in the solution, which is an undesirable compound formed, which is not needed for us, and that is altering the appearance of the preparation. And the chemical interaction is nothing but when we are adding two or more mixtures, because of the chemical nature, if they are getting interacted, then such an interaction is called as chemical pharmaceutical interaction. And these physical interactions are of various types, like immiscibility. Immiscibility in the sense, if we are taking two different phases. For example, take oil phase and water phase. So oil phase is not mixed in water phase, or water phase is not mixed in oil phase. They are two immiscible. They are not mixed with each other. Insolubility. So one drug is not soluble in the other. So one drug may not be soluble in alcohol. So the solubility of the drug should also be checked. So for example, if we take the paracetamol drug, it is soluble in water. So if at the same time it is not soluble in benzene. So if we put the paracetamol in benzene, then that leads to insolubility. The solubility of the drug is also main important. Precipitation. So if the drug is interacting with the solvent, then it may form precipitates leading to a new compound. And liquefaction. Liquefaction is nothing but, say if we are giving one drug and excipients are added, because of the pressure which is created, the drug or excipient is converted from solid form to liquid form by the application of pressure, or the application of pressure between the molecules, that may form a liquid compound which is not desirable. Chemical interactions are of two types, tolerated and adjusted. So tolerated are nothing but these are the chemical compounds, in the sense the interaction may be tolerated, or else the interaction may be tolerated to some extent. And adjusted in the sense by adjusting. So by adjusting the one or two or else we can say by adjusting one or two compounds, the appearance or the interaction can be reduced to some extent. The other one is management. How the drug interactions are getting managed. So first thing is that dose related events. So we have to be very careful regarding the administration of dose. For example, if we take miconazole gel as well as warfarin, so these are therapeutic indexes. So the dose of these drugs should be monitored in order to prevent the drug interaction. The other one is the erythromycin and terfenadine. So these are the drugs which should not be given in combinations. So if we give in combinations also, there should be some time gap between these drugs, because in order to prevent the drug interactions. And the other one is dose spacing. So for example, if we take the drug like ciprofloxacin, so the ciprofloxacin, it will avoid the binding of ciprofloxacin by ferrous salts. So if the ferrous ion preparations are there, and they will or else they will alter the ciprofloxacin absorption or binding. So the dose spacing, if we are giving, for example, the ciprofloxacin should be taken thrice a day. So if you are taking thrice a day, one should be given in the morning, afternoon and evening. So some time gap should be there between the dosing in order to prevent the interactions of the drug.